The purpose of this review article is to do an update about diagnosis and treatment of chronic migraine. In the last year, 2013, the third edition of the International Classification of Headache Disorders published the review chronic diagnostic criteria for chronic migraine. Chronic migraine has been defined as headache occurring on 15 or more days per month for more than 3 months, which has the features of migraine headache on at least 8 days per month. In the last decade, several diagnostic criteria and definition has been proposed for chronic migraine. However, now, patients meeting criteria for chronic migraine and for medication-overuse headache should be given both diagnoses. From an epidemiological point of view, the prevalence of chronic migraine may range between 1 and 3%, and incidence may be around 2.5 per year. Chronic migraine has been also associated with disability and poor quality of life. Several modified risk factors have been identified and include migraine progression, defined as an increase in frequency and severity of migraine attacks, medication and caffeine overuse, obesity, stressful life events, and snoring, among others. In addition, a significant higher frequency of some comorbid conditions has been identified in chronic migraine, and these include chronic pain conditions, psychiatric disorders, for example anxiety and depression, respiratory illness, and some vascular risk factors, including high blood pressure or diabetes mellitus. The management of chronic migraine is indeed very complicated and includes identification and control of comorbidities and risk factors that predispose to chronic migraine, the treatment and prevention for medication overuse, the early treatment for migraine attacks, and adequate preventative therapy for chronic migraine. Several randomized controlled clinical trials have shown the efficacy of topiramate and amitriptyline on a botulinum toxin and cognitive behavioral therapy in chronic migraine. In this review article, we will also review the evidence in the literature regarding the potential efficacy of other drugs, including elsunicamide, pregabalin, gabapentin, among others. I hope that this article will be helpful not only for neurologists, but also for general practitioners and for those health workers that are interested in the field of chronic migraine.